Hi, it's Dr. Centeno. I want to talk today about should you get a back fusion? And the short answer is no. So, the low back is made up of vertebra backbones that stack on top of discs, which stack on top of vertebra. And you can see off to the right there the facet joint, which is the joint between the two backbones, right where they come together. So, your spine is built to move. And I tell my patients that fusion is a dog with fleas. And it's because of that motion that fusion is such a problem. Fusing any level of your spine with hardware just causes overload of the adjacent segments. And we see many patients who have pain above and below their fusion. In fact, if I had $1 for every single patient I had seen after fusion who was miserable, it would be insane because this is a very common phenomenon. When the next level gets arthritis due to all this overload and all this extra motion, it's called adjacent segment disease. And that's where bone spurs can press on nerves and facet joints can press on nerves because of the arthritis caused by the fusion. In addition, recent research has shown that adding in a fusion to a laminectomy surgery where you're opening up the spine for something like spinal stenosis is a dumb idea. It does nothing to improve outcomes. All it does is to increase complications. So for the vast majority of patients, a low back fusion is a dumb idea. Fusion predictably breaks down the next unfused level. And in our experience, most fusion candidates can be treated with precise placement of their own stem cells and platelets to help the ligaments, muscles, joints, and nerves. Most patients don't need to get a fusion. So see Regenexx.com for more information about how you too can avoid the need for this really invasive, awful surgery.